Hi, my name is Gabby, and I'm going to be talking about the physician assistant career. So, a physician assistant, or a PA, is an advanced practice provider, and they're individuals who, on a daily basis, will see their own panel of patients. They can come up with continuous treatment plans. They often order and interpret labs and imaging, as well as prescribe medications. PAs can also perform small procedures. This would be something like a skin biopsy. And lastly, they can work in surgery as the first assist to the surgeon. And it's important to note that all of this is done in collaboration with a physician. So how do you become a PA? So in order to be a PA, you have to first gain a bachelor's degree. And in addition to this, you must have completed the required prerequisites of the programs that you have applied to. Next, you have to gain clinical experience, and I have an asterisk next to this because this does vary depending on the schools that you're looking at. However, most programs require at least a little bit of direct patient care experience. Take the GRE exam, again an asterisk here because this is not a requirement at every school, however it is pretty common. You then have to apply through CASPA, which is the centralized application portal. Hopefully you'll land some interviews with the programs you applied at, and once you make it through your master's PA program, you have to pass the PANCE, which is the board certification exam. So getting into a little bit more detail here is a pretty common list of the prerequisites you'll have to take in order to apply to PA school. This does vary school to school, however, just about every school is going to require what's on this list here. The only two that often vary are going to be organic chemistry and biochemistry. So some programs will require that you take Organic Chemistry 1 and 2. Some programs might just require Organic Chemistry 1. I've seen some programs that do not require biochemistry at all. However, this is a pretty standard list right here. So just touching back on the clinical hours, or what they call direct patient care, like I said, most programs do require at least a minimum of 500 direct patient care hours at the time of application. So some of the most common options are medical assisting, certified nursing assisting, EMT, LPN. As long as you're working directly with the patient and you're having some effect in their care. So I just wanted to explain a little bit about the difference between a PA and an MD or a physician, because I do see this confused pretty often. So to become a PA, you have to have a bachelor's degree and then complete a 2-year master's program. Whereas if you want to be a physician, you must have a bachelor's degree, complete a 4-year medical school program, and then additionally you must match into a residency program. So physicians become certified in their specialty of choosing, whereas PAs have a lot of lateral mobility, meaning that they are not certified in just one specific area. They can jump between specialties at their leisure. And at the bottom, I just put physician's assistant here with the asterisks. This is something that I see is done incorrectly often. So PAs are not the doctor's assistant. They are their own advanced practice providers. So for my interview, I chose to interview Mr. Jesse Hammond. He is a Massachusetts native. For his undergrad, he studied biology at Bridgewater State University. After graduating a couple years later, he ended up jumping into a master's physician assistant program at Northeastern. So I asked Mr. Hammond what did he do prior to PA school and why he chose to go the PA route. So prior to starting PA school, after having graduated with a degree in biology, Mr. Hammond worked in a cardiology office, And here he did stress tests on patients as well as echocardiograms. So that's a great example of direct patient care. He said that working in cardiology really sparked his interest in pursuing a more advanced role in healthcare. He mentioned that he wanted to be working more directly with patients and being able to make more calls for himself. And he also added that the PA route was ideal because it was only 2 years of graduate schooling as compared to 4 years of medical school. So I asked Mr. Hammond what a typical day looks like for him as a PA who's been practicing for numerous decades now. So Mr. Hammond works at North Central Correctional Institute, and he's contracted under a company called the Vital Corps. So he works in a prison every day, and he's actually the medical director there as well. So typically his day starts off with reviewing any lab results and any other diagnostic studies that he ordered in previous days. He then preps his charts for the panel of patients he's going to be seeing. He said typically he sees between 10 and 12 patients. This is a lower amount of patients than a normal PA would see, and this is due to the fact that he is the medical director and has a lot of other administrative duties as well. So in the corrections setting, Mr. Hammond says they provide a lot of primary and urgent care to the population. So things he does on a daily basis are inject cortisone shots, a lot of suturing, splinting, as well as incisions and draining. He said this is because in the correction setting you have such a large population in such a small area, so infection rates can run pretty high. So after getting through his panel of patients for the day, Mr. Hammond spends the rest of his day documenting and taking notes for his patients, as well as consulting with any specialists as needed. So I asked Mr. Hammond what the best part about being a PA is, and I was actually pretty surprised in his answer. I was expecting him to say that getting to help people and getting to care for people is the best part of his job, but he actually said that is not what he enjoys most. And what he actually said word for word, and I thought this was interesting, was that putting the pieces of the puzzle together, so taking the clinical presentation of the patient and using his diagnostic skills to achieve the correct diagnosis and effective treatment plan. So Mr. Hammond said that the prison population can be a really challenging group of patients to work with, and a large part of that population struggles with substance abuse disorders as well as personality disorders, and this ultimately manifests in really strong drug-seeking and manipulative behavior that can be really difficult to navigate. So he finds it really rewarding when he's able to correctly diagnose and treat his patients. I asked Mr. Hammond if he felt he was adequately compensated for the services he provides. Today, a lot of healthcare workers are saying that they're overworked, burnt out, and not compensated adequately. So I was really pleased to hear that Mr. Hammond said he feels more than adequately compensated. So he's worked for the same corrections facility for 25 years now, and in that time he said that he had often had his compensation adjusted. Additionally, now that he is working as the medical director of the facility, his compensation was directly impacted. One of the last things I asked Mr. Hammond was if he would do anything differently. So I asked, if he were a student again, would he still take the route of becoming a PA? Would he do something different? And I was really happy with his answer. So he said, nope. He looks back with no regrets, and he would not change a single thing about the path he took in pursuing a career as a PA. He explained that while his role can be really challenging as both medical director and an advanced practice provider, he feels very satisfied by his career choice. He said that being able to get to the bottom of a patient case and achieve the proper diagnosis is really rewarding for him. After speaking with Mr. Hammond, I was definitely both encouraged and relieved. I myself am in the process of interviewing at PA school, so it was really nice to speak with someone who still, after 25 years, really enjoys what they do. Like I said, a lot of people today in healthcare feel very burnt out, undercompensated, and overworked. But after speaking with Mr. Hammond, I felt completely reassured that I'm going into a career that will provide me with a lot of different opportunities and a lot of reward. Something I did learn was that even though PAs must work under the supervision of a physician, they can still achieve a number of different leadership roles, such as medical director, like Mr. Hammond. I was surprised by this. I would naturally think that a physician, an MD, would be the person to work as a medical director. However, Mr. Hammond reminded me that PAs do have extensive training and a really strong education that qualifies them for these leadership positions. And after speaking with Mr. Hammond, I would definitely say I am more interested in the PA career than I was before, which is great.